Honorable Chief Guest, respected dignitaries, teachers, and my dear friends, a very good morning to one and all. We are into the fourth technical section of the two-day international webinar on women and development. First, I would like to welcome the chairperson, Dr. Manju Nair, for chairing the session. Dr. Manju Nair is the Dean, School of Social Sciences, University of Kerala, Professor, Department of Economics, University of Kerala, Honorary Director, Center for Agroecology and Public Health. Her areas of specialization lies on econometrics and macroeconomics. She is an expert member of Doctoral Committee of Indian Science and Technology, Kerala and Mahatma Gandhi University. She is a member of various professional bodies, including member of Indian Economic Association, Indian Association of Social Sciences and Health, and Indian Econometric Society. She is a renowned economist and a renowned presence in various international and national seminars. She has a wide number of papers published in various national and international journals. A renowned economist, with great honor and pleasure, we welcome Dr. Manju Nair for the session. Welcome, ma'am. In this session, we have the presentation on domestic workers in Kerala during the pandemic, a situation and analysis from dignity and rights perspective by Dr. Lekha Bhat, Dr. Sumalatha BS, and Dr. Chitra KP, Central University of Tamil Nadu. Dr. Lekha Bhat is Assistant Professor, Department of Epidemiology and Public Health, School of Life Sciences, Central University of Tamil Nadu. She has received her MPhil in Public Health and a PhD in Social Medicine and Community Health from Jawaharlal Nehru University, New Delhi. She has also worked as Assistant Professor in Mizoram University. Her areas of specialization include gender and health, adults and health, social determinants approach in public health, and qualitative methods. She had a number of papers published in national and recognized journals. With most happiness, we welcome on behalf of Department of Economics, University of Kerala, Dr. Lekha Bhat for the session. Welcome, ma'am. Dr. Chitra KP, Assistant Professor, Department of Social Work, School of Social Sciences and Humanities, Central University of Tamil Nadu. She is a PhD from Tata Institute of Social Sciences, Mumbai. Her area of specialization is community development, and her interest areas are environment and development, ecological social work, practice, social policy and legislation, participatory action research. She has published a wide number of papers and received different fellowships. With much pleasure, on behalf of Department of Economics, University of Kerala, we welcome you, ma'am.
Thank you.
Dr. Sumalatha BS had completed her MPhil in Applied Economics from JNU to CDS Trivandrum and his PhD from Madras Institute of Development Studies, Chennai. She was an assistant professor at Department of Economics, Central University of Kerala, and is now an assistant professor at Department of Economics, Central University of Tamil Nadu. Her research areas include developmental issues, macroeconomic issues, agricultural development and issues, land holding, asset holding, and inequality. She had a number of papers published in various national and international journals. She is a recognized expert in international and national seminars. With great honor, we welcome on behalf of Department of Economics, University of Kerala, Dr. Sumalatha BS for the webinar. Welcome, ma'am. Next, I welcome all the respected faculty members of the Department of Economics, University of Kerala. I also welcome Kiran, first MA student of Department of Economics, who will be delivering the vote of thanks. Next, I welcome all the participants who have joined us for the webinar. Once again, I welcome you all. Now, I hand over the session to the respected chair for the further proceedings. Over to you, ma'am.
Good morning, everybody. So, respected Siddik and other dignitaries and dear students. So, welcome to the fourth session of the technical session of the international webinar on women and development. I take this opportunity to place on record the department's gratitude and appreciation to Sri Siddik Rabiyath for coordinating this very useful webinar on women and development. So I also welcome the speakers, Dr. Lekha Bhat, Dr. Sumalatha, and Chitra KP. And the session is on domestic workers in Kerala during the pandemic, a situation and analysis from dignity and rights perspective. So I don't want to speak much on the topic because people who are very specialized in this area is going to speak. I'll just share one or two observations that I have regarding the domestic workers during the pandemic. So I have often heard comments from many of my friends and relatives regarding the domestic workers during this pandemic. So I'll just quote one example where one of my friend told me that I'll just share the example in Malayalam. I don't know whether you'll be able to follow. I'll then translate it into English. So I remember I was going through the program brochure and this came to my mind. I remember one of my friends in Karivatam telling me, "Oh, ഇത് വലിയ കഷ്ടമാണ് ടീച്ചറെ കോവിഡ് ആയതുകൊണ്ട് ജോലിക്കാരിയോട് ഞാൻ വരണ്ടാന്ന് പറഞ്ഞു എവിടൊക്കെ കയറി ഇറങ്ങി വരുന്നതാണെന്ന് നമുക്ക് എങ്ങനെ അറിയുന്നത് വെറുതെ വന്ന് എൻ്റെ കുഞ്ഞുങ്ങൾക്ക് എന്തിനാ അസുഖം പിടിക്കുന്നത് അപ്പം നല്ലത് സ്വിഗ്ഗിയിൽ നിന്ന് ഓർഡർ ചെയ്ത് ഭക്ഷണം കഴിച്ചാലും ഈ വൃത്തിയില്ലാത്തതുങ്ങളെ ഒന്നും വീട്ടിലേക്ക് കയറ്റണ്ട." This was a common talk that many of the Keralites, the so-called high-class ladies were giving during this pandemic regarding this domestic workers. I'd just like to translate for those who don't understand Malayalam. So one of my friends was telling me that now I have stopped. I have asked the domestic worker not to come to my home because I'm not sure of the places where this lady will be visiting prior to coming to my home. And some very degrading words like "nerangit variga," I don't know how to translate it into English. And then this friend was telling me that so it's better to order food from outside rather than asking this lady to come and cook and get my children infected. So this not only means what we are denying them of their right of life or right of economic security that these people are getting, but it's also a question of dignity because I understand that the talk is also on dignity. That's the first observation that I would like to share with you. And another observation was we also have domestic workers who are staying with the family. So again, one such observation was made by one of my friends who was telling me that now sadharana എല്ലാ മാസത്തിലും 2-3 ദിവസം വീട്ടിലേക്ക് പോകണം ഇവൾക്ക്. ഇപ്പൊ എന്തായാലും കോവിഡ് വന്നത് നന്നായി. കാരണം ഇവിടെ പോണ്ട, വീട്ടിലേക്ക് ഇപ്പൊ പോണ്ട, പോയാൽ തിരിച്ചു വരണ്ട എന്നാണ് ഞാൻ പറഞ്ഞിരിക്കുന്നത്. കാരണം എന്താ, പോയി കഴിഞ്ഞാൽ അസുഖം കൊണ്ട് തിരിച്ചു വരും. അതുകൊണ്ട് കഴിഞ്ഞ 6 മാസമായിട്ട് ഞാൻ വളരെ സന്തോഷത്തിലാണ്. ബിക്കോസ് I have not allowed the maid to go home. Now, this is the case of a worker who is staying with the family. When the master was sharing her experience that it is good that the pandemic came, that I have asked my servant not to go home because if she goes home, she was allowed to go and meet her children twice, 2 days in 1 month. And now I have denied this right. And I have asked her that if you go home to meet your children during these 2 days, you need not come back. Because once you come back, you will be coming back with this problem of COVID. And so I'm very happy that she has not gone to her home for 6 months. So this is again very, very, very I don't know how to put it in to the language that I can use to describe this, whether the mother is denied of the right even to see her child for the last 6 months. So these two issues are the common talks that we hear in Kerala regarding the domestic workers and how the people, those who are employing the domestic workers, the attitude to them, how these people are denied of their rights, all these things. I just don't want to theorize those things. We would like to listen to these very 3 persons who are very much in this area, and then we will have, I understand that we will have a very good discussion on this issue. So welcome you, ma'am, for your presentation.
Thank you, ma'am. Thank you so much. And thanks to all the organizers and Dr. Siddik for giving us the platform for this international webinar on women and development, where we can share our research findings and some of the thoughts and reflections on this very pertinent issue of domestic workers. I'll try to share my screen for a small PPT presentation. I hope it's visible.
Yes, it's visible.
So, Manju ma'am has already given a very nice, crisp introduction to to the problem which is so pertinent in the society. So we have modified the title a bit, rather than sticking to only Kerala context. When the paper was invited, the data from Kerala was collected and it was completely analyzed. By now, this time we were able to put more data into the paper. So we made it more generalized so that we'll cover 3 cities from across the country, Mumbai, Delhi and Kochi. So the title is changed a bit as domestic workers during the pandemic, a situational analysis from dignity and rights perspective. And my co-presenters are Dr. Sumalatha BS and Dr. Chitra from my university. Yeah. So when the pandemic hit the world, as an introduction, when the pandemic hit the world in December 2019, and as the disease was spreading gradually to the other parts of the world, countries after countries were forced to declare complete lockdown or partial lockdown. So due to the pandemic, when the global economy started to come to a standstill, and when partial lockdowns or complete lockdowns were announced, the world saw a lot of unprecedented level of social and economic distress, which affected the livelihood across the spectrum of all the social classes. However, we can see that the employment prospects and social security of those who are working in informal sector stood most affected. And amongst this also, women from informal sector were the worst affected, or they were worst hit, because of the informal nature of the economy in which they are engaged in for their daily livelihood, and also the work burden and other tasks that they have to meet at the household level. On the onset, we could see that domestic workers faced a total or near unemployment due to the social distancing norms and the lockdown restrictions in the country. And they were seen to be not considered, or they were always kept outside the picture of relief measures that were offered by the government of India and other state governments and other stakeholders like NGOs and other community groups. The context of this work is we are having a project with the National Human Rights Commission, NHRC funded project, in which we were trying to explore domestic workers' lives in Delhi, Mumbai, Mizoram, and Kerala. So for that work, by this time we had done a bit of recruitment and data of domestic workers, basic data on how to contact them. A basic list was collected from across these states, and we were about to start our work. And that particular work is focusing more on livelihood issues, their working condition, wages, safety at workplace, from a human rights point of view, so that we will be able to provide some policy inputs for the commission's papers and policy briefs. So in that context, we had already developed contacts with the workers and the NGOs, few of the NGOs which are working in this area. But due to lockdown, we couldn't launch our work. So that is the time when a lot of media reports, popular media reports started coming in, mentioning the works of domestic workers' plight, and then ASHA workers' plight, then workers who are engaged in street vending, their problems, especially women. So then our research team, constituting of 3 of us, thought, why don't we explore some of the problems of domestic workers in this pandemic context? Because at that point of time, it was not possible to go ahead with the original research with which we wanted to engage with, because of the methodological problem. Now, because of pandemic, their livelihood issues have accelerated. Their wages are on no wages, and working conditions further deteriorated. So we were apprehensive to launch the project, as well as it was not possible to conduct the work because field work, nothing was allowed. So it is in this context we thought, why don't we explore some of the issues in context to this pandemic specific issues. So for this, This is the background of domestic workers in India. I'll come to the methodology at a later part of presentation. There are no clear statistics available in the country about the number of people who are engaged in domestic work, or what are their working conditions, and what kind of social mobility they have when they work in this particular field for say 5 years, 10 years, 15 years, or what are the social security measures or welfare measures available to them. Are they members of any organizations or associations? So there is no clear statistics available. So some of the data available is from National Domestic Workers Movement, which says that the current number of domestic workers in India ranges officially from 4.2 million, which is according to the NSSO. At the same time, government itself is countering it, and documents produced by NHRC and National Commission of Women says the unofficial estimate is more than 60 million. And according to National Domestic Workers Movement, which is one of the largest nationwide engagement with the domestic workers, according to them, it will go up to 50 million. And 2/3 of these workers are serving in urban areas. And most important thing is 75% of this workforce of domestic workers consist of women. So all the issues that are pertinent to women specific work context or workforce is applicable to this particular group also. And due to the informal nature of their work, their pressure and their working conditions are more pathetic. Adding to this, due to the non-recognition of the work as work per se, so it is considered as a help at home. Okay, women is coming to help at homes. That is the term generally used. So it is not recognized as a work, or it is not considered as a skilled work. And most of the time, their income is not considered as a main contributor to the family income pool. However, in reality, if we go to field, we can see many of the women, they are the single earning families, or it is not a supporting income or supplementary income. It is the main source of income for majority of the workers with whom we interacted with. So this is the basic context of workers in India. So the workers are unprotected by any labor legislation apart from this one act, Unorganized Workers Social Security Act of 2008. But due to the informal nature of the contract which they have with their employer, and workers themselves are ignorant about such an act and its provision, and there is no organized collective platforms and forums which are available in the country, like government board, government owned welfare board. Only 3-4 states are having some government owned welfare boards for this particular category of workers. So it leaves them at the mercy of the employer. So though one act is there which covers them to some extent, but the act is not implemented in reality in the field. So no rights, but charity or philanthropy based approach in work relationship. So you are always or a worker is always at a mercy of the employer. If employer feels happy, he will give you a hike. If employer feels angry, he will shout at you. If employer is a person with basic importance given to human rights in his basic life principles, then you may be entitled to get minimum wages. So this is the condition. And the latest one is a national policy for domestic workers has been drafted by the government of India in 2008. From then, it is under discussion, consideration, revision, modification. For different forums are inviting new recommendations, new perspectives, and it is not yet finalized or implemented in the country. So this is the present context in which domestic workers operate in this country. Some of the studies, recent ones, have identified that they are always underpaid or unpaid for overtime, and occupational hazards are commonly high, which include backache, which include abnormalities in periods, which include lethargy, weakness. Poor working conditions. This includes leave, as Madam mentioned. Employers are always unhappy if the domestic worker takes leave for even one day. We prefer them to have in our house, if possible, 24/7. Otherwise, at least all the 7 days they must come. Working hours. No flexibility in working hours, and whatever is the requirement of the employer, accordingly you have to adjust. Safety at workplace, very important as far as domestic violence, sexual abuse, verbal abuse, then such issues are concerned with. And lot of times unproven arguments about theft is also put on this poor ladies without any proof. Then dignity of work. When you work for a firm, or when you work for an organization, or when you work for an individual, you expect a minimal level of respect just because you are a human being. As Immanuel Kant says, respect the person just because the person is a human being, rather than using him or her as a tool to meet your certain requirement. The basic dignity at work, that is missing. Then physical and sexual abuse is commonly observed. Works of Hamid in 2016 and after 10-11 years in 17 proves that in 7 cities the work was carried out in India. Physical and sexual abuse is widely reported. Verbal abuse and shouting. Then feudal nature of work. Some caste relationships which operates in the northern part of the country and some of the northeastern part of the country. And also considering this work as a kind of bonded labor. That means shifting the work from family to family, especially in the rural areas of the country. So all this coupled together makes the working conditions very poor for the women. However, if we see, they are contributing to the development of the country, right? Because women themselves are able to get out of their house and go for work in offices, middle class families or high class family, whatever, are able to get involved in the workforce just because we get a support from some woman as a domestic worker in our own house. So they are also contributing to the economy of this country or development of this country, but it is all unaccounted and not calculated for thereof. So this is the study context. Another work by Goyle and group, they observe that majority of the domestic workers remain jobless for a short period, and drastic salary cuts affected livelihood of women domestic workers during this pandemic period. So as we all know, the pandemic has brought unprecedented impact on women's life. Let it be women from domestic worker background, women who's sitting at home not working, women who's working in an office, women who's a professor, whatever, women's life is severely affected and curtailed by this pandemic because their workload at home has increased, level of stress and anxiety has increased, and studies across the world and data from UN Min is supporting this particular argument. And it was in somewhere in June, July, media reports started coming from Delhi, Mumbai, Bangalore, and Jaipur about the plight of these domestic workers, that even after the lockdown, partial unlocking and phased unlocking, they are not able to get back to their work. So no social, as they don't have any social security measures in place, they were completely dependent on the goodwill of the employees for this particular period. And the support from employers is very poor. It is not employee, it is employers, I'm sorry. In Delhi, reports from Seva say that majority of the workers are without any documents in place, government issued identity card or government issued any document. So they could not access the social security and relief measures offered by the government. And in Delhi, most of the cases, they were migrants. So whatever issues that were pertinent to migrant group, plus work issues related to domestic work, plus issues related to women specific, all these issues started affecting the life and livelihood of women in Delhi. In Kerala, the workers who were predominantly natives, because in Kerala, domestic workers, majority are from Kerala only. maybe from other districts of Kerala. They might be coming at stay home kind of an arrangement. Otherwise, they are natives. So they could avail free ration and community kitchen services instituted by the state government. Now, lack of registration of domestic workers with unorganized sectors, social security boards denies the women workers any of the government relief that was available during the pandemic times. For example, the government in West Bengal and government in Rajasthan, they had some of the new schemes announced specifically for women in women in informal sector, especially construction workers, domestic workers, street vendors. However, since domestic workers are not registered with any of the social security boards, their access to this particular system of support was too minimal. During the pandemic, 80% of high volume workers, that is the women who are domestic workers and engage in more than 10 jobs per week, they all ended up jobless. And due to this, half of the domestic workers reported lack of access to medical care during this period. So it not only affected the livelihood per se, but it had impact on the healthcare access and the health of the workers. So this is brief about the methods and materials which we have used. In the context of the pandemic and lockdowns and phased unlocking, domestic workers' livelihood issues, working condition, health issues, that is non-COVID health issues or health problems, and healthcare access was explored. And also we tried to identify and situate the fear, anxiety, stigma, and discrimination experiences these women faced during the pandemic. And some of the instances and narratives about domestic violence and sexual abuse during this time was also explored. And this is the study sample size. 260 domestic workers from 3 major cities of India, New Delhi, Mumbai, and Kochi, were interviewed. And telephonic interviews were conducted. In the first round, we collected data on livelihood issues, working conditions, health issues, and healthcare access. At a later stage, after 2 months, we again try to contact them and get fear, anxiety, stigma, and domestic violence and sexual abuse. So this is a general profile of the respondents whom we interviewed. 30% of them belong to OBC, 25% to general, and 24% to SC category, and 16.9% into SC communities. And age-wise categorization shows that majority of women belong to 40 to 49 years, followed by 34-41 and 26-33. So these all are women who are having familial responsibilities. They are breadwinners, or sometimes sole breadwinners, or sometimes supporting the husband. So their income is a major determining factor for the quality of life of the family members. 53% were migrants, predominantly from rural village to the capital of the state. And migrants are more in Delhi and Mumbai. And 47% were natives. And natives as domestic workers is more in Kochi. So highest migrants were in Delhi, followed by Mumbai, and least in Kochi. And see, 30% of the workers served more than 6 to 10 years of their working period in this particular sector. Still, even after 6 to 10 years, no social security, and employer-employee relationship was not so cordial and trustworthy that they couldn't even get advances for 1 or 2 months, even though the employer had the capacity to pay or afford. See, a majority, 28.8% completed 11 to 15 years. So we can see there is no much mobility or social mobility or improvement in terms of living condition or working condition that is happening. And there was a considerable number of people who are engaged in this particular work for more than 20 years. And as the years of work engaged increasing, health problems they report is also increasing. See the monthly income. More than half, 54% reported a monthly income of 5,000 to 10,000. And this figure went a little higher just because in Kerala the wages were little better compared to Delhi and Mumbai. So in none of the states or none of the cities uh, minimum wages are provided. Not even minimum wages, at least 20% of the wages, that is also not ensured. Only 20.7% had a monthly income between 10,000 to 15,000. That too, if they are at stay-at-home maids. That means 24/7 you are staying with the employer. In that case only, your income is on a little higher side. Majority of the respondent, 94.6%, did not avail minimum wages at all. This is not only during pandemic; it is a common across their lifespan. 94.6% of workers did not have access to PPF or NPS type of savings. So there is no compulsory savings, though they have in Kerala, many of the workers have gone through various organizations like middle men kind of associations which have come up, placement agencies type of organization. But even in that case, there is no security measure or there is no provision of PPF or any kind of a compulsory saving in which employer will also be providing a particular percentage. It was found that only 22% of the respondent had any membership in any organization or association that is working for the rights of the domestic workers. So this women themselves are not considering this as a skilled work, or they are not feeling that pride that, okay, this is my job, because the society is also not recognizing, and over a period of time the same thing is socialized in, internalized so much that they get surprised when you say that there are organizations, but the organizations are not funded well, and due to their own working conditions and minimal fund availability and resources availability, they are not able to reach out to the 100% of the domestic workers working population. A good majority of 77% did not have any membership in the association, which is a worrying thing. See, in the time of pandemic, what happens is 45% had lost their job between the period March to June, when it was almost complete lockdown across the country. 45% have lost the job. And during the time of interview in September, October, the second time, 52 of the response, that is 44%, remained jobless. Joblessness was recorded highest, followed by Delhi and Kochi. So whatever madam was telling, that was a better state of domestic workers in this country. See, status of work in March, April, 45% is losing. Then during the second interview, some 80% have gone back to work, whereas 20% is still jobless. In Delhi and Mumbai, we can see that the employers unilaterally terminated the service, telling that they are carriers of virus, they are unhygienic in nature. But till 2 months back or 1 month back, they were very hygienic. They were acceptable to your expected level of standards, but suddenly terminated unilaterally. Whereas in Kochi, the lack of public transport was cited as the major reason, rather than opposition or unilaterally terminating from the termination from the employer. It was mentioned as lack of public transport in Kochi. Workers faced stigma and discrimination. 57% of the workers mentioned that they have faced some kind of discrimination, and they were projected as viruses and considered as unhygienic in nature, and were openly humiliated in many instances. In Delhi and Mumbai, this is high because it is residents welfare associations, it is flat system and societies. So you need the permission of the society's general body or executive body to get entry. Whereas in Kerala, it is more independent house system. So employer had more say in the case of Kerala, whereas in Delhi and Mumbai, though employer wanted, if the resident welfare associations are not supporting, then it was difficult to come for the work. Majority of them did not receive the salary for the month of April, which caused acute distress. So the data shows that in the March before the lockdown started, though they worked for 20 to 23 days, which we also work. If you take Sunday out, 25 days we work or 24 days we work. So even in that case, 57% of the workers did not receive the salary of the March month, mentioning that they have not come for the whole month. And the lockdown was announced overnight without any previous information. So for that also, they had to bear the cost. Now, what were the reasons for losing the job during the pandemic? Three major reasons pointed out are employer terminating the service. Then another 18% feared own health. So this 2 and 4, transportation restrictions and fear of own health, this is in Kerala case more. Whereas employer terminating services were more in Delhi and Mumbai. Reduced salary. 50.4% experienced a reduced salary, increased workload, or both together during the pandemic. So after June, July, the 80% of people who are back to the work, for them, this 50% have experienced a reduced salary and their workload has increased because now everyone wants job and all employers are not happy to welcome the domestic workers at home. So the demand has come down and workers are jobless. In that case, employers bargaining space increased. And what they started doing is they started either reducing the salary, though the employer had the ability to pay. They started reducing the salary by a particular percentage and started giving extra work. Like if a domestic worker was doing only, say, cooking, then now cooking plus car cleaning. Or if the person was doing only cooking and now the employer is not willing to engage her in cooking, in that case, all the outside work, go and buy the vegetables, then do the car cleaning. So all the other works with which the person has comfort, interest or not, or comfort or not, gardening, all such works are now handed over to the worker. Employer support. In some of the cases, employers have also supported the workers, but it is very minimal. If you see, around 40% have not received any kind of support. And these are the workers who have engaged with the families for more than, at least in our interviews, we interviewed only people who are engaged with a particular family for more than 2-3 years. 2.5 years, not less than 2 years. In that case, even after 2 years of unconditional support from your domestic work, you are not able to provide them any support during the time of crisis. Majority received a small help from employer as groceries. 13.8% mentions that they have received some groceries. Only 3.5% is receiving some extra payment or advance is received by 10%, and some 13% have 10% had a frequent phone calls and inquiry and so and so forth. So we can see that majority did not receive any support, concrete support. Livelihood and household dynamics. The income, their personal income or monthly income is reduced. See, 33% report that their income is reduced by 80 to 100%. That is jobless or almost jobless kind of a condition. And another 28% reports that their income has reduced by 40 to 60%. This is a serious concern because, as I told in the beginning, majority of the women are providing a substantial contribution to the family income pool. Now, withering of the savings and borrowing from money lender during the pandemic. We can see 58% are reporting whatever savings they had. This is 58% again because of Kerala respondents or Kerala sample, because if they are part of Kudumbashree or similar forums, they had a small compulsory kind of a saving which they were doing. So in that case, it is 58%. So this 58% are mentioning their savings are withering away. 41% are not having any savings. Now, in money lenders case, 59% have ended up borrowing money from money lenders. and 41% are not borrowing. In this 59% or so, majority are borrowing from money lenders, and few are, especially in Kerala, they are borrowing money from Kudumbashree kind of arrangements or small sector cooperative banks, wherever they have some kind of a financial support. Now, the household dynamics. 35% of the respondents are managing the household expenses with this reduced income, whereas another 24% families are making use of existing savings to meet the needs. So this existing savings include their assets. So especially in Mumbai and Delhi, we can see many of the domestic workers reporting that they had to sell their personal belongings, like maybe small piece of jewelry or cycle or TV or some small patch of land in back their native village, handing over it for cultivation for next 5 years to their immediate relative. So they gave some money. So some kind of a arrangement. The interstate analysis shows that more women from Kochi reported increased household workload. So in home also their workload has increased because husband and family is at home, so the care you require to provide and the other household task is increasing, and to some level education of the children is also now women's responsibility. So household workload has increased, whereas women from Mumbai and Delhi are reporting more instances of stress, fear, anxiety. This is because the majority of them are migrants also. So whatever stress, anxiety related to land, house rent, paying the other bills, throwing them out of the neighborhood because it is not their own house and they are going out for work outside their locality. So all this stress and fear is building up for the women who are from Delhi and Mumbai. Whereas in Kochi, the reports are more of increased household workloads. Again, exploring the household dynamics, 25% of the women are reporting that the domestic violence instances they face have increased in terms of the intensity and frequency. And 42% of women, irrespective of the city, reports that their household workload has also increased. And only see 10%, 11% women feel that there is no substantial change in the household dynamics as far as domestic violence is concerned, fear, anxiety, marital relationship, the space between the family members, household workload sharing is concerned. Only 10%, 11% are mentioning that there is no change. Now, the frustration, anxiety, and financial compulsions during the pandemic are in a way ventilated on the women. So the husbands or the male counterpart of these domestic workers are employed in small scale works like street vendors or construction workers, taxi drivers. So they are also jobless, or they are also in a way on a low paid salary, increased uncertainties. So all these anxiety, frustrations, and financial compulsions will be ventilated on women. So that is why the instances of domestic violence, sexual abuse, verbal abuse, stress in the marital relationship have shown an increase. All the family members staying together the whole day in a small room in a congested living condition causes increased workload, conflict, and privacy issues in the household. So what happens is, when the situation was normal, after the domestic work in different households, this lady will go take her bath and have some leisure time for herself. Again, evening, if she has a second shift, she will go after 4:30. So that time is a private time for her, leisure time for her, watching TV or relaxing or talking with the neighbors or just sleeping, because their work, especially in Delhi, starts at around 5:30 in the morning to reach to the first house. So that the leisure period that they derived during that particular gap is now gone, because all are at home, no privacy and no leisure time, and due to social distancing and other norms which are again and again reinforced by ASHA worker and other health workers by repeated visits to their slums. So it has reduced their social life, or compromising their social life. So this brings in a lot of anxiety and stress in this women. And less food intake. Women from Mumbai and Delhi have even reported the instances of complete starvation and hunger during March, April. Whereas women in Kerala, they are reporting more of a food basket diversity has reduced. So in one place, it is not having food at all, no quantity, whereas in another place it is the quality and the nutrition level and the food basket diversity, like now not buying fish, not buying egg, or not buying vegetables, whereas here nothing is available. So there is interstate variation as far as food intake is also concerned with. If we see the health and healthcare access during pandemic, 42% of the domestic workers had some health issues for family or self during this period. It is not COVID, non-COVID ailment. So some reported reproductive health problems, some reported pulmonary issues like TB, some had anemia, some had treatment for breast cancer, some were pregnant. So some or other issue 42% had, and in that 42%, 67% had to discontinue the treatment of the illness, and up to March to September. So many have missed immunization of children. Many pregnant domestic workers have missed their own antenatal checkups. 3-4 cases who were taking breast cancer treatment from government facilities, that is discontinued. Chronic TB, multi-drug resistant TB cases were there, 7. Their treatment, which is very dangerous. Multi-drug resistant TB, starting a treatment and leaving it in between is too dangerous for the person as well as for the people who are in the neighborhood. So treatment had to be discontinued for 67%. And many cases of backache, sleeplessness, weakness, because food intake is now poor, quantity is reduced, and people feel women are reporting more weakness, maybe anemia, but we have not gone for a blood checkup to verify it. It is their perceptions and their feeling of well-being that they have shared. Treatment of women was discontinued easily than that of men in the household. So if there is a priority to be given for both of them, or children is also in picture for immunization or some other disease, then first the treatment of women was discontinued, then treatment of children were discontinued, then last the treatment of man, because he is considered as the breadwinner and his care and life was given more importance. 90% of the workers are having some level of anxiety, reporting some level of anxiety with severe sleep problems, sleep problems up to 45%, which is a very worrisome thing from the point of view of clinical psychology. Reason for discontinuing the treatments during pandemic. It is evenly distributed, as you all can see. Unaffordability, lack of transportation, and no outpatient services is available in the government hospitals. So these are the 3 major reasons they pointed out as the reasons for discontinuing the treatment. And anxiety scale was used. Corona anxiety scale is developed by a group of scholars in China, Liu and group. So 3X's 8.8 item anxiety scale was used, and these are the anxiety scores. 46% of the women are expressing high anxiety, or their scores are high, which is a worrisome thing. And another tool, another scale with 12 items on fear of COVID was also employed for this work. And we can see 40% of women are reporting high fear. Expression of stigma, how the employer or the society in general were expressing the stigma. Avoiding interaction, the moment the workers come. This happens not only with employer, in their own neighborhood also, because if they are in the neighborhood and doing work there, like street vending, doing the work there itself, they are acceptable. But if they are going out of their neighborhood and working and coming back, that was not acceptable. So avoiding interaction is in both the side, employer as in resident welfare societies as well as in this neighborhood. Contempt, expressing the contempt, using the expression to show that the job is too menial and indignified. Then ventilating and showing anger, 30%. Direct order not to come for job for next 5 months, next 8 months, don't come for job. So direct orders. And scolding and abusing. These were the various ways in which the stigma was expressed by the society. What was the state support that these people received during the pandemic? 70% received some kind of a support in form of free food or ration, whereas only 33% or 34% approximately are receiving some kind of a financial aid, which was promised to be provided through the Jan Dhan account. So in this 260 people, only 50% had a Jan Dhan account. That means 130. In that also 130, only 33% received some kind of a financial aid from the government. And what are the experiences of domestic violence and sexual abuse during the COVID-19 pandemic presents new realities and complexities about the domestic violence and sexual abuse. Across the social class, across the professions, women's experiences of sexual abuse and domestic violence has increased. That's a report from UN Min. And some supportive studies are coming up from Spain, Italy, Saudi Arabia, and couple of Latin American countries. So in the same direction, women's inability to seek immediate help from anywhere is very evident. So what happens earlier is, if there is a domestic violence incident happening in a house, either neighbors will interfere, or parents or relatives who are staying in nearby area will come, family friends will come. Now, due to social distancing and this fear and apprehension of this particular disease, especially these women are going out of the neighborhood for work, nobody is willing to come immediately and help. Same way, there were NGOs that are involved in providing help. Now NGOs work is also stopped. They are not coming to the field. Everything is operating online. So their immediate involvement or help is also not available. So around 40% faced domestic violence during the last 3 months, and intensity and frequency is increased. And the person who are committing domestic violence is husband in the case of 39%, brother in the case of around 19%, and others insignificantly father and torture from in-laws. And what were the manifestation of this domestic violence? How domestic violence was happening? In 15% case, it is verbal abuse only, whereas in 54%, considerable number, it is taking away the earnings and personal assets. So as per UN definition, it includes verbal abuse, physical abuse, taking away personal earnings and assets, and to some extent, sexual abuse. So this all is considered as domestic violence, provided it is happening within the purview of the home. Physical hitting and a combination of all these things for another 18%. Reasons for increasing the sexual abuse and domestic violence: husbands' joblessness and frustration. They are all the time at home. Their fear and anxiety is ventilated on women. Wives' availability at home for a longer duration of the day. When she's going out for work in 2 shifts, so many hours she's not available at home. Now, because of joblessness or less job or less number of people with which she is engaged in the work, she is available at home for a longer duration. Alcohol, recreation, and non-availability of these things. Otherwise, men used to go out, play cards, or have alcohol together in a group. Now all these venues were closed in September, October. So these are the reasons pointed out by these women for increased instances of domestic violence. As far as sexual abuse is concerned, 32% are reporting the increase in the frequency and intensity, mainly faced from husband, and in a significant percentage from employer as well. Asking sexual favors, forcing for sexual relationship, and followed by forcing to do sexual activities when body is tired. These are the definitions given by women for sexual abuse. Domestic violence cases were more reported from Kochi, surprisingly, followed by Mumbai and Delhi. Whereas in Kochi, the definition of domestic violence is taking away the personal earnings and assets without her consent. So whatever savings she had, whatever small income earnings she had maintained in an FD or small kind of investment, or some small gold items, cycle, those kind of things were taken out. So that is definition in Kerala. Whereas in other 2 cities, it is clearly verbal abuse and physical hitting. And in the case of sexual abuse, more cases are reported from Delhi and followed by Mumbai and least from Kochi. So there is a need for inclusive policies to place this whole work in a larger context. These are some of the reflections and insights from the work. And we need to have more inclusive policies or welfare oriented measures, so that in future at least we are well prepared for such pandemic. Otherwise, in the absence of pandemic also, this particular group is entitled to have a right based approach rather than always focusing on charity or philanthropy based approach, and relying upon the goodwill of the employer for a stable livelihood. There is a need to shift from charity based approach to a right based approach, ensuring formal and better working conditions. So there should be some arrangements made in a way that the conditions are better, working conditions are better, the system is more formal in nature, so that their exploitation and uh, the vulnerabilities will come down. Ensuring the minimum wages, need to have compulsory savings and other financial security measures, need to have government issued identity cards for this worker, some kind of a legal protection. Though one act is there, it is not covering them in reality, so some new legal protection measures has to be enforced, and need for association and collective bargaining platforms for this women, addressing problems peculiar to women force in general, like safety at workforce. So this kind of things is applicable for domestic workers also. So some arrangements and mechanisms at policy level has to be developed for workers. So placing it in a much more larger context, available with the support of available literature, we can see the pandemic has further widened the gap between the gender inequality and gender and inequality. The study findings point out that women's workload has increased both at home and in the workplace, followed by loss of wages or reduced wages. This is coupled with fear and anxiety about the infection and bringing in acute mental stress. And access to healthcare is now restricted, whereas incidents of domestic violence and sexual abuse increased. In informal sector, women who have quit or forced to quit working end up doing more domestic work than fathers in the similar situation. So studies coming up from other parts of the country is also in the same direction, and findings are corroborating with each other. Study from this is from China again, showing that men compared to men, women are twice reporting inability to buy essentials, whereas Black women in informal sector are 3 times likely to be as likely to white men reporting this acute financial problem. No, Lianin work is from Brazil. This is Chinese work. For countries like India, where women are a heterogeneous group, evidence from across the spectrum is needed to be recorded to develop increase and programs in the post-COVID context. The experiences and lessons from the previous pandemic also suggest. So if you take the studies that are done during swine flu and avian influenza, that studies are also showing that there is wide gender gap, and after the pandemic, gender inequality widens, and women's workload, stress, and mental health is severely affected in 2010 and 2007 episodes as well. During the pandemic, women are disproportionately overburdened and stressed because of their lack of access to social, economic, and healthcare resources. In the case of COVID-19, mortality rate of men is higher than the women. So number of deaths is high in men, whereas the impact of that in economic sphere, mental health, and psychosocial areas is more for women. Women around the world hold fewer formal jobs, and they end up earning and saving less, largely lack any social protection, and impact of pandemic on women in informal sector is the worst. Gender impact is not limited to economic sphere. So these are studies that are coming up from various parts of the country, China, UK, USA, Saudi, Egypt, everywhere. The study findings are corroborating with each other and showing the same direction, that women's work burden has increased, domestic violence, sexual abuse incidents have increased, safety at workplace is reduced. So as a conclusion, COVID-19 pandemic has left remarkable impact on women's health, healthcare, work environment, house dynamics, followed by experiences related to domestic violence and sexual abuse. So we call for more empirical work. This is a very small sample, and the limitation of the study is more descriptive in nature, and telephonic interviews, so narratives and all were limited. However, we for more empirical works amongst women across various strata. So this is just a glimpse of domestic workers in India. Same way, street vendors, women in construction workers, women who are employed in beauty parlors. So every set of women, especially who are in informal sector, their problems need to be documented and studied, so that some policy level implications can be developed. Need for more interdisciplinary studies with large samples and cross checks. So as we are three from different disciplines. I'm from public health, Suma is from economics, and Chitra is from social work. So some kind of a comprehensiveness we tried to bring. So we need more interdisciplinary work so that we can place it in more theoretically as well, and come up with some concrete solutions and suggestions. Conducting gender analysis of the impact of the pandemic is very important. Whereas till now there is no information from the government that such a large scale activity has been carried out or is planned. Though the Ministry of Women and Children, the ministry has come up with a small policy brief that they are planning for something, but nothing is concrete or materialized. We also call upon governments of various countries, especially Indian government, to consider the gender impact of the COVID-19 pandemic before planning the social, health, and economic relief measures or interventions for the future. With this, we would like to conclude. These are the references.
Okay, thank you, Dr. Lekha, for your very informative and detailed presentation based on the study you did in some selected states in India. So she has looked into the livelihood, the working conditions, the health conditions, etc. of the domestic workers, and also on the fear, the stigma, the discrimination, the violence, etc. These people faced during the pandemic, and has reached the conclusion that all these aspects, the livelihoods, employment prospects, social security, etc. of the domestic workers remain very lower, and they were particularly affected during the pandemic because more than 50% of them have lost their job, and it was always an unilateral termination. And say 57% reported what as the stigma projected. These persons were projected even as viruses, very unhygienic and very humiliated in many places and instances. And there has been reduction in salary, and the employers' bargaining skill has increased. And she has also looked upon the workload and the stress at home, and has reported that there has been an increase in the workload and the stress at home. And the treatment in the health aspects, the treatment of women were discontinued because of that. The pressure on the household, the anxiety, the fear and stigma has increased, and there has been an increase in the domestic violence and sexual abuse, and everything with interstate variations. And she has reached given some concrete suggestions also, particularly moving from a charity-based to a rights-based approach, then assuring formal and better working conditions, the legal protection, ensuring safety at the workplace, etc. So I think this has been a very informative one, madam. But I would also like you to brief upon, maybe describe more on the particular methodology that you have used, because it is a telephonic interview, and as you said, it has lots of limitations. So once you go a telephonic interview, so narratives may be less. Then how did you come to these percentages, etc. Out of the 250? If you have a questionnaire, if it's rather easy, or an interview schedule, it's rather easy. Now, what was the process by which you went through this? Because I think the students would also have a doubt on the methodology that you use. But I know that that's only possible way by which you can do a survey during this COVID period. And I also invite other participants to raise their questions or doubts or clarifications. Maybe you can directly ask to Lekha ma'am, or you can post your doubts in the chat box. So thank you.
Thank you, ma'am. Thank you so much. Regarding methodology, during this pandemic, when we contacted them around March last, April first week, for the first time, we already had developed some list for our actual project. So we had numbers of these people with us. telephone numbers. So first we thought we'll develop a Google form, but we realized they don't have enough of a number of Android forms or the ability to read and do the answering. So we literally had to call each one of them. 250 people, we had to call each one of them, spend time with them, and then collect the information. So in the beginning stage, we went with common, because we don't know each other too much. So we went with the common questions, which are not very sensitive in the first stage, livelihood issues and working conditions, stigma. Those later stage only we explored the domestic violence and sexual abuse, when I again contacted them somewhere around September, October, for a second follow-up, whether they are back to job or not. And then we entered the data as usual in Excel. We had developed a questionnaire, and according questionnaire were marked, the data was shifted to Excel, and then the data analysis was done. That is why I mentioned there is limitation of this study, that is telephonic interviews. But at that point of time, getting that data was very important, because if you collect it after a point of time, the factor of forgetting, such confounding variables will start coming into picture. So whatever within limitations possible, we try to collect the data. It was a questionnaire, and we asked them. So it is interview schedule, we can say. It is interview schedule. We asked them telephonically and recorded. And the rate is we took from some of the people whom we were knowing, either by personally or by our friends. Earlier employer was our friend, something like that we had to use, because talking over the phone about sexual abuse and domestic violence, it is very difficult. So you need some level of a comfort zone, right? So in that we had to go for a choosing, and people should be willing to talk to you over phone, say for 30 minutes, 40 minutes.
And ma'am, how many respondents were contacted?
250. We contacted around 326. Some answered half. So eliminating all those people, we had 260 as a sample size.
Thank you, ma'am.
So any more
That is
questions?
why now we need more empirical works. Now the restrictions are all lifted and everything is back to normal. Still, the workers are not back to their normalcy. Whatever they called as normal, even that normalcy is not restored. In that case, now it is the ideal time to have more works with women in informal sector in general.
Okay. So good to know that, ma'am, you have collected panel data, that is across the same cross section. You have collected data at 2 time points, and maybe if you are going for, as you suggested, if you are going for a third time series data, that's a third point of time, then maybe you will receive or get good insights into the process, whether they have reached the normal stage or something like that. Okay. So there is, I think, one more question. Do you have any policy suggestions for the gender park? Gender university. Okay. How do you look at the establishment of the first gender university in Kozhikode? Through the establishment of the park, the aim is to make changes in gender-related matters through policy interventions. Do you have any policy suggestions for this? So Shreya is asking this question.
Yeah. See, do we actually need a separate university or a separate space to look into gender issues? It should be generally integrated into the normal structure of the society, isn't it? That is my take on that. I don't know.
Ma'am, it is
It
said
should
to
be
be modeled.
integrated.
Ma'am, it is said to be modeled on various institutions which abroad have similar courses related to gender studies. So, looking at the Indian context, do we need a separate discipline, or, as you said, do we need to integrate more into the mainstream education these gender-related issues? So, that was what I was trying to ask, ma'am.
See, I am a person who stands for universal kind of a thing, rather than particularist way of looking at things. So my point, it might be correct, it might not be correct, it might be acceptable to others, might not be, but for me it should be integrated to the, no, why should we have a separate then tomorrow for disability studies something, again and again we are segmenting and segregating and making it into components, right? Rather than that, we need integration. That is my stake.
No, there is two different things, disciplinary segregation as well as university as a whole.
Yeah, segregation
You
might
should
help.
have a discipline,
Disciplinary segregation will help. However, university kind of a segregation, I am not in support.
Yeah, I understand. Thank you, Lekha. I do have actually a proposal because in regarding this, work which you people have done, what we are also thinking is to have a survey COVID-19's effect. Okay. The university is now asked to conduct a Kerala, not only Kerala specific, if possible, a national level survey. At least Kerala and South India can be covered. So about the impact of COVID-19. So sort of a survey, which is we are planning.
Nice.
We are very happy that, if the CUTN also.
Yes. Yeah, sure.
Better.
Yes,
I hope that will come up. And also having in mind that to collaborate with the university in Hyderabad, University of Hyderabad. And
okay. So we'll work out.
Yeah, because
It'll be interesting.
Yeah, we need to really know about the informal as well as formal if possible. But first, look into the informal sector, how the impact of the informal sector over the period of a year is in fact affected the overall performance of the sector. So that is what is the idea. So I would be very grateful if you guys.
Sure, we'll be very happy because that will bring more interdisciplinary and interstate variations into focus, which is now lacking.
Yes, that is what is actually we want. At least a kind of a data set we need to collect in that sense.
Will do. Nice to see you, Siddik, after such a long time.
Thank you. And so Lekha, I thought you are in Mizoram. So
No, 4 years back I moved from Mizoram. 4 years I served there, then I moved.
That is great.
Okay, shall we leave?
Okay.
If there is any other question, then please actually have, and after that we will have a formal vote of thanks. Earlier session we missed one vote of thanks. So
So I think there is no more questions. So thank you, Dr. Lekha, Dr. Sumalatha, and Dr. Chitra for your work, and particularly for the interdisciplinary study integrating public health economics and social work. And thank you for accepting the request from Siddik that you can have a collaborative study that the university has proposed regarding the implications of COVID-19. So once again, from the part of the Department of Economics, we thank all of you for giving consent and for taking your time to present in this webinar. And now I invite, I think it's Riya who is going to deliver the vote of thanks. I invite Riya of First MA to formally propose the vote of thanks.
Excuse me, Manju, it's not Riya, it's Kiran is presenting. I took it from her.
Okay. So I invite Kiran of First MA to propose the vote of thanks. I think Riya's name was in the brochure.
Yeah, ma'am. Then it came. Okay, ma'am.
Okay.
Good afternoon to one and all. It's indeed my pleasure to deliver the vote of thanks on behalf of Department of Economics, University of Kerala. I take this opportunity to express my gratitude towards Professor Dr. Manju S. Nair, Dean of Social Science and Faculty of the Department of Economics, University of Kerala, for chairing this session. Thank you, ma'am. I thank Dr. Lekha D. Bhat, Assistant Professor, Department of Epidemiology and Public Health, Central University of Tamil Nadu, Dr. Sumalatha B.S., Assistant Professor, Department of Economics, Central University of Tamil Nadu, and Dr. Chitra K.P., Assistant Professor, Department of Social Work, Central University of Tamil Nadu, for the paper domestic workers during the pandemic, a situation analysis from dignity and rights perspective. And I also thank Dr. Lekha Bhat for presenting the paper that covered the domestic workers in Mumbai, Delhi, and Kochi, and delivering an insightful lecture on this two-day international webinar on women and development. I thank Nelsa Rosepier of 2nd MA for the welcome note. I would like to thank all who raised their questions and thank all the participants of the session whose presence made this session a success. Thank you all.